Austin is now home to the first dedicated pediatric cardiac care unit in Central Texas. The 24-bed unit officially opened today at Dell Children's Medical Center to treat children as young as infants with the most serious heart conditions by using state-of-the-art technology.
KXAN Morning anchor Sally Hernandez sat down with one of their leading heart surgeons for a closer look ahead of today's opening.
This is just one of the multiple simulations that we're doing to make sure that we're actually ready for the opening. So we're testing different scenarios to be able to make sure that our staff and nurses are ready.
Kind of explain to our viewers, what does that mean and why is it significant?
So the simulation is becoming more and more important just to be able to try and practice multiple times before you actually have to do something important.
And what is that in the background? What is that noise?
Well, that's the simulated heart rate.
Tell me about before, what would happen if somebody had a significant heart defect?
The families would have to leave Austin, uproot their families for about 6 months, which is the time that it takes between the first operation and the second operation, and then go to Houston or Dallas for care. So that's not the case anymore.
And how exciting is that for you as a doctor to be able to say, we can do that for you right here?
Well, it's extremely exciting, and that's actually the reason why we came to Austin to be able to provide this care and create this program.
Tell me about the need for this program.
So congenital heart disease overall affects about 1 in 100 patients, 1 in 100 births. So it is not that uncommon.
Did you see a need right here in Austin for that program?
There's a huge need, and a reflection of that is the fact that since we've started the program, we've been seeing patients and operating nonstop. So there is a huge need, and we're basically honored to be here to be able to provide that care.
The survival rate of babies with congenital heart defects depends on the severity of the defect, when it's diagnosed, and how it's treated. But 95% of babies with non-critical defects live at least to the age of 18, and about 2/3 of babies with critical defects live that long.